So today I'm sitting down with Dr. Lyle Berkowitz, who is a great friend of mine and one of the greatest industry leaders in the virtual care space that I know. So thank you so much for joining us today.
Thanks, Grace.
So tell me a little bit about what you feel is one of the most critical and pressing issues facing healthcare right now that you feel like people will be talking about in health.
Yeah, I think the same issue we've had for a while is access to care, inconvenient access to care. We recently did a survey asking patients why this was important. 75% said they want to have a telehealth virtual option for care, not only because it's more convenient and more accessible, but they also brought up things like we don't like to go to a place where there's a bunch of sick people and be in a waiting room with people sneezing on us. And they even said stuff like, we don't want to bother our doctors with minor stuff. We have a major issue in today's 24/7 world where our doctors are mainly 9 to 5. They're mainly booked out for, most studies show 30, 40 days at least. And we will do a lot of good in this world if we can improve access to basic care.
Could not agree more. I mean, you're preaching from the choir, right? Because everybody is seeing it. It's impacting everybody. What innovations do you feel are critical to solve this pressing access issue?
Well, as you know, I'm a big fan of virtual care, but that in and of itself is not enough. We have to combine it with some amount of automation and self-service, etc. This is where AI will start to come in, which of course is going to be a hot topic. But AI is a technology. Where do we apply it? And I do think that we can use it to make the overall process of care more efficient for the doctor in particular, who's our limited resource, but still high quality for the patient. Really important to still be able to combine both of those. I think we'll be seeing more of that combination coming together. And interestingly, best done in a virtual care setting. If someone walks into my office, as you know, I was a primary care doctor for 20 years, we can't necessarily mandate that they have gone through some AI check-in process or some type of automation. But if they're coming to see me in the virtual world, in the telehealth world, we can essentially mandate, hey, you've already figured out how to get online. And now we're going to have you go through this automated system to get to us, and we're going to make sure we're efficient. So this concept of virtualist as a new type of specialty, separating out from the officeologist, there can and should be differentials in terms of the complexity of care and the type of technology used in both situations.
Thank you for joining me today, and I can't wait to see you in Vegas.